All right, everyone. Hi, I'm San Francisco Mayor London Breed, and I want to thank you all for joining us today at Sheba Lounge. I want to give a shout out to the young folks, Vax to Max. Thank you for hanging out and trying to get people to vaccinate, because I know you want to go back to school quickly. I don't know about you, but when I was a kid, I wasn't pushing to go back to school on any given day. And clearly, our children need to be back in school. And part of making sure they're back in school, making sure they're safe, making sure our communities are safe is important for us to do our part. And this is how everyone can do their part, is at least get vaccinated. In San Francisco, about 84% of San Franciscans have received at least their first dose of the vaccine. But sadly, with the African American community, that's about 64%. With the Latino community, it's at about 74%. And we need to make sure that those communities are getting the vaccine, because what we're seeing with almost 100 people now in the hospital, that most of those folks are African American and Latino. And so it's important to us, because the other issue is that most of the people who are in the hospital, I think Dr. Colfax has the specifics, but they've not been vaccinated. So even if, I as a vaccinated person get the vaccine, if I get the COVID-19, there's a possibility that I can transfer that to someone who isn't vaccinated. And the fact is, that person can get sick and end up in the hospital, and that person can potentially die. So this really is a matter of life or death. I understand people have concerns, and I understand that people are frustrated with the mask mandates and all the other requirements. I get it. This has been tough, and it's been a long time. But as I have said time and time again, just because we are tired of the vaccine, just because we are tired of COVID-19, just because we are tired of all the rules and regulations and being told what to do, just because we are sick of it, doesn't mean it's sick of us. It's not gone because we want it to be gone. So what this means is we have to do even more. And as a result, we have decided to take our case to the public in a different way. If you have at least 5 to 12 people who want to be vaccinated, we will bring our doctors and nurses and equipment and other resources to you. All you have to do is go to sf.gov/vax2you or call 626-652-2700. So we'll provide you all with that information. It's important that we make it as easy as possible for people to get vaccinated. Maxine Hall, which is located on Turk and Webster, you can just drop in. San Francisco General, 2401 Keith in the Bayview. There are a number of pop-up locations in the Mission. We are trying to make this as easy as possible. And we know that there are some people who have underlying health conditions. We know that there are people who have even a fear of needles. We know that there are challenges and concerns about the history and vaccines, specifically in the African American community. But the fact is, we're at a different time where we really need to focus on saving lives. We've not even had 600 deaths, even in one of the densest cities in the country, in the last 15 months because of this virus. But if we go out the rate that we're going, we expect within a couple of weeks, according to Dr. Colfax, to lose at least 300 people. That's why we've had to put together the appropriate vaccine outreach teams, as well as mandatory masks indoors, even for those who are vaccinated. We know that it is just exhausting, but here we are, this last hurdle, the last thing that we need to do, and we need everyone to do their part and to get vaccinated. And with that, I want to turn it over to Dr. Grant Colfax to talk more specifically about some of the numbers that I may have gotten right or wrong and where we are. But as I said, we want to make it easy. Get vaccinated. That's the easiest thing you could do to support one another. In this city, we should be so proud because San Francisco is a dense city and we had one of the lowest death rates. We all came together in the beginning of this pandemic. We took care of our neighbors. We looked out for one another. We went shopping for our seniors. We made sure that we protected and supported one another, and look at what we've been able to accomplish. We should all be so proud. So let's not stop now. We got that last hurdle, that last stretch. It's like the ninth inning or whatever you want to call it, and we just need one more hit out the ballpark. That's where we are, folks. And if we all just roll up our sleeves and start to get vaccinated, even though we have concerns, we're doing it for our fellow San Franciscans. And so with that, I want to turn it over to Dr. Grant Colfax.
Well, good afternoon, everybody, and thank you, Mayor Breed, for your ongoing leadership during this pandemic. I want to thank Sheba Piano Lounge for sponsoring this. Max the Vax team, you guys are awesome. Saw you in action. You brought someone off the street and you got vaccinated just now, so amazing. And then, of course, the amazing DPH vaccine team, the mobile team, led by Dr. Mary Mercer. Just remarkable work. We have 77% of eligible San Franciscans now fully vaccinated in our city. So this is a remarkable achievement. And I think while the next few weeks will be very challenging and we're seeing COVID-19 increase dramatically in our city, it's very important to remember that hundreds, if not thousands, of lives have been saved. We're in a much better place than we were during this past, during the fall and winter surge, because people are vaccinated, because these vaccines work, because they keep you out of the hospital, because they are saving lives as we speak. If you are not vaccinated right now in San Francisco, this is not a good time. This is not a good time to be unvaccinated. The Delta variant is here. It accounts for more than 90% of our cases now, and it is a highly transmissible, and there's emerging evidence that it's a more virulent virus, so it's more likely that you would end up in the hospital compared to the virus we were dealing with just a few months ago. This is COVID on steroids. This virus is different from the virus we were dealing with a little bit ago. The difference now between being vaccinated and not getting vaccinated could be the difference between sniffles and suffocation. If you do get COVID-19, it could be if you're vaccinated versus not vaccinated, it could be the difference between spending a few days in your bed at home versus spending a few weeks in the ICU bed. So very important that people get vaccinated. We know that the health officers across the region recently instituted an indoor masking mandate effective today. That is a temporary measure to decrease the spread of this virus. We were at just 12 cases of COVID-19 just a few weeks ago in late May, early June. Now we're over 200 a day. So we need to continue to slow the spread, do our part. We will bring the vaccine to you. The mayor just announced this. We're doing everything we can. You have 5 people, you have 12 people, you have more people. We will work with you. We will get the team there. Let's max the vax. Let's max the vax across the city. 77%, more to go. We're doing everything we can to get people vaccinated. The vaccines continue to be our way out. These next few weeks are going to be challenging. The best protection is the vaccine, the masking, and telling your friends, your family members, your community members, get vaccinated today. Thank you.
Any questions about the vaccine related stuff? Dr. Colfax?
If I have 5 to 12 people in my family, would you come to my house? Is it that kind of
Yes,
deal?
we can do that. We've already been doing that, and we go to people, our mobile teams are deployed, so people can sign up and we will be there.
Can people from outside the area come to, hey, I live outside San Francisco, it's going to take a long time for me to make an appointment, so I call the number and come and meet you anywhere?
We're really focusing on San Francisco's residents at this point to try to get those numbers up, and we're coordinating with other counties. So I think if people have questions, we can put them in touch with their local health department to ensure that they can get vaccinated as well.
Why don't you talk about Zuckerberg, SF General, and the decision to have the supplemental shots for those who are getting Johnson & Johnson shots? It sounds like the policy of the hospital is going to be now to also give them a shot of an mRNA shot, either Pfizer.
So I just want to make it really clear, we have not changed our policy as a health department and as a city with regard to following CDC guidelines for administering vaccines. If people have received a Johnson & Johnson and are requesting a second shot, we will accommodate them. But our policy has not changed, nor has it changed at Zuckerberg San Francisco Hospital.
Have there been studies done on that? Because I'm not aware of any studies about that. I just
So,
don't know the science behind it.
yeah, so I think that they're, in consultation with infectious disease experts at UCSF and in other places, the decision was made again, if people are requesting a second shot after Johnson & Johnson, we will accommodate that. But we're not changing our policy at this point.
Any indication that it does boost the efficacy of the Johnson & Johnson shot against the Delta?
So I think the important thing is that right now we don't have conclusive data on additional shots beyond what CDC is recommending. But again, in consultation with infectious disease experts, we do believe this is safe and that we will accommodate people if they so request.
Are the breakthrough cases, are they mostly people who have been vaccinated with Johnson & Johnson, or why Johnson & Johnson?
So I think the key point is that breakthrough cases remain relatively rare compared to people who are not vaccinated. That's really important. All these vaccines are incredibly effective in terms of reducing the risk of hospitalization. And again, we're continuing to follow CDC guidelines with administration of vaccines, whether they are mRNA or the Johnson & Johnson vaccine, accommodating people if they've received Johnson & Johnson and are requesting an additional shot. But the breakthrough infections, I think really, I understand the focus on breakthrough infections here, but I think it really misses the big picture. The key reason we did the indoor mask mandate and so forth is because we need to get more people fully vaccinated as quickly as possible. That includes Johnson & Johnson, that includes the mRNA vaccines. We will continue to follow the data, science, and facts with regard to any boosters in the future and follow CDC recommendations going forward.
Are you still administering the J&J?
Absolutely.
Like
The
J&J
is a good vaccine. It's a good vaccine. We will continue to administer it. And we have lots of vaccine available. If people want the mRNA vaccine, we will give that. We're doing all three here today, in fact. So, we have the menu and it's available.
What would you say to people who are tired of wearing masks, and do you know how long the mask mandate will last?
Well, I'm disappointed that the health office. I'm sorry that we had to go back to indoor masking as well. It was the right thing to do in terms of where we are right now. Especially our projections are showing, cases are going to continue to increase through this month and early September. So we really need to slow down the transmission. What I would say is if you're tired of wearing a mask, if you're not vaccinated, for God's sake, get vaccinated and get your friends and family vaccinated.
Is there any effort right now to start revamping some of those mass testing sites? Because now that this Delta variant is surging and it is so much more contagious, a lot of those big sites, they've shut down. Are we thinking about restarting those?
So we're continuing to work with our other health partners across the city to ensure that there's adequate testing for people. DPH has been doing over 40% of the tests that have been administered. So just to emphasize that piece, working with Kaiser, CPMC, UCSF, we continue to have testing capacity. So right now that's not an acute issue, but we're exploring a number of possibilities. We know that compared to where we were, there's a lot more home testing available. So we're encouraging people to use that as necessary, and then talking to our partners about expanding testing options in the future. And at the health department, our testing focus remains in our clinics, for the SNFs, the skilled nursing facilities, and shelters. So those are really key areas where we're going to continue to support testing.
A lot of people are saying that they're taking days to get an appointment online when they go onto the SFDPH website. What are you hearing in terms of wait times, and is the city considering those mass testing sites that are coming in?
So again, we're looking at options to potentially expand testing. It's not just DPH testing, but encouraging our other partners, Kaiser, CPMC, and UCSF, to expand testing. And we have drop-in testing as well. We have pop-up testing in neighborhoods where COVID-19 is most prevalent. So at those drop-in sites where people can literally walk in, you can still get tested just on a drop-in basis.
Roughly like 5,000 tests are being done a day.
That's right.
The latest data. Where do you expect to see that number? Where do you want to see that number? Because at the height of it, close to 10,000.
Yeah, well, I think testing is obviously an ongoing key issue for us to support across the city. Again, I don't want testing to distract us from the need for people to get fully vaccinated. But we expect testing demand to increase just like it did for the fall and winter surge. I'm hoping we can mitigate some of the wait times. I expect those to unfortunately continue to go up because we were down to fewer than 2,000 tests a day not very long ago. Now we're at 5,000. If we expand up to 7,000 or 9,000 a day, we're going to continue to need to expand. But again, we're encouraging people to consult with their provider to get a test and or to use those home testing kits that are now widely available. You can use them at home and use the Kaiser, UCSF, and other healthcare systems in addition to looking at what the health department has available.
Is it fair to say that the city is spending more resources on these vaccination sites such as mobile clinics versus testing?
Well, I think so. The vaccine, because it's more complex, we have always spent more resources since we've scaled up vaccine than testing, just because testing is a little bit easier. But we are going to continue to look at the ability to expand testing as we continue to support the vaccine efforts. We can do both things at the same time. But we're in a different stage here now during this fourth surge, and the vaccines are now here, so we need to try to do both things well at the same time.
Do you expect that we'll see a rollback of other restrictions here in the city? And if businesses were to require that you be vaccinated in order to enter that business, would the city support that and roll back on
Yeah.
restrictions?
So we're very supportive of businesses and other entities requiring proof of vaccination for people to enter the premises. Yes.
And now the state, New York City is doing that, right? They're talking about they want in restaurants and at venues, at fitness centers, proof of one vaccination at least. Is the city considering taking that step?
We're exploring that. Again, right now we've seen that a number of bars and restaurants and other entities are doing that, and we're very supportive of that and encouraging people to take advantage of that policy with regard to showing proof of vaccination at these entities.
One more question. What goes into deciding if San Francisco will institute a vaccine mandate similar to New York City? Like, why not yet?
Well, I just think we're exploring the pieces right now. Again, I think that the good news is that San Francisco businesses were one of the first in the country, as far as I know, to adopt this voluntarily. And I think it's really trying to determine, in working with various entities, is there a need to implement a policy similar to New York's, or is this going to happen, more on the basis of what's being driven in the community? I think we saw that in other situations with the pandemic as well, as communities are adopting the practices that they know slow the transmission. So again, we're exploring that. Thank
What
you.
do you say about the people that are afraid about the side effects of the vaccine? That's why they haven't taken it.
Yeah, I mean, we know there have been millions and millions of people in the United States who have received this vaccine. The side effects are mild. People recover from them. These vaccines are incredibly safe, and the benefits of these vaccines are just profound. I mean, look who's dying of COVID-19 right now in this fourth surge across this country. It's people who are unvaccinated. These vaccines work. They're safe and effective. Thank you.
So I want to thank Ned and Israel from Sheba Lounge for hosting us today. Are there any other questions related to the vaccine? All right. Any other questions in general?
Mayor Reed, could you comment about the stipulation you signed regarding the fines? And if you wouldn't mind also speaking to anyone who may have lost confidence in you around these issues, what you want to say to restore that confidence?
Well, what I want to start by saying is the stipulation that I signed with the Ethics Commission after having numerous discussions, I feel is fair. We worked out an agreement with the staff to address some of the challenges that we are listed in the stipulation, and in particular, there were mistakes made. I take full responsibility for those mistakes, and I've learned a lot since becoming mayor and being in office. And as I said in my statement, I made it clear that at no time have any of the things related to this stipulation had any impact on the decisions that I've made as mayor. And my hope is that over time I've been able to prove that, and over time moving forward I'll be able to continue to approve that.
And anything to anyone who lost confidence in you?
Well, I hope that the work that I've done throughout the past couple of years in addressing one of the most challenging times in our city's history, which again is not directly related to the challenges that exist in this stipulation, I would hope that my record and what I've done over the past couple of years will make a difference, as well as the work that I do moving forward. I mean, it's difficult because people may look at this, of course, and feel a certain kind of way. I can't completely control that. I can only make sure that I do exactly what a leader in this city should do. When you make a mistake, you step up, you take responsibility for your action. You put it all out there, and you hope that people will look at it and realize that you're human just like anybody else. And the goal is to make sure that I completely make it clear to the public that at no time in any of these challenges that existed that I allow any of this to impact the decisions that I've made in running the city. And that's going to take some time to demonstrate and to ensure the public that my goal is to lead the city, to continue to do my job, and at no time have I ever allowed any of these issues to interfere with the decisions that I make in this office, and I will continue to do that.
Did you believe you were doing anything wrong at the time, whether, the three issues, the float, the letterhead, regarding the letter for your brother, or having, Muhammad Lulu fix your car? And did you recognize that those things were questionable?
At the time that I did them, no, I did not.
And now?
And now I do understand that, yes, they are a problem, and I will be doing things differently. I mean, for example, the event, the Pride Parade in San Francisco, I've always had a float during the Pride Parade. It's just that the way that it was covered this time during this time period was different than how I had covered it before. And so I realized that that was problematic, even though the Pride Parade is not a campaign event. It's a civic occasion. It's a way in which mayor and public and elected officials all participate. But I've always had it afloat, and in this particular case, there was a mistake made, and so we're correcting that mistake. Okay. Any more questions? All right. Thank you.